When examining an infant for a nursing assessment, you want to look at them and look how they're lying, how they're relaxed. Do your hand hygiene to make sure. Inspection is always very important, and a lot of times people rush through and immediately just want to listen to them, listen to their heart and lungs, and that's it. But look how they look. How is their skin color? Are they breathing comfortably? Are they in a nice alignment? Keep them covered in areas so you don't get them chilled, but it's also, you do want to look at them totally to see if they are, I talked about the straight alignment, are they calm? Do they calm down quietly with your voice? Whenever you're doing an assessment, so I'm going to cover up the baby right then, but I want to listen to the heart and the lungs first, because once they start moving and crying and making noise, it's going to be very hard to get a heart rate. When you're, so get that heart rate right away, get the respiratory rate, do a full cardiac and respiratory assessment, and listen for the abdominal sounds. Again, just like with the adults, get the apical first. With children, their heart rates are going to be irregular. You do it for a full minute to get that. Remember, it's about the fourth intercostal space, mid-clavicular, where you will palpate, feel the apical pulse. Take it for a full minute. Then you want to listen to each side. This stethoscope is large. You can use one, but it is better to use a pediatric stethoscope. And listen to the sounds of the aortic, pulmonic, inch down. Do the fourth of the tricuspid, mitral. Listen for your with the bell to do the same areas. See if you hear any of the sounds of the a murmur or an S3 or 4. Some young children, you may hear an S3. I'm going to listen for the respiratory sound, the anterior. Make sure you're comparing. Get the sides. This baby won't bend, but I want to listen to the back to hear the posterior sounds. Again, comparing side to side. Go ahead and do your abdominal sounds while you have your stethoscope and they're quiet. I'm going to wait to remove the diaper totally when I'm doing the genitalia exam. Then the babies, when they start getting towards 6 months old, 6, 7 months old, and they're afraid of strangers, this is when you can examine them in the parent's lap. It's a much easier exam for them. And you approach them very gently. Wait till they get used to you. I usually talk to the family members while they're holding them, and then gradually do the listening first. But inspect so head to toe, working my way down, I'm going to inspect the head, the shape, size, contour, feel the anterior fontanelles, the posterior fontanelles, any tabs behind the ears, check the clavicles, the neck, any lymph nodes. I don't like to go looking at in the mouth and the ears when they are the prying it open is the first thing, because that will get them more upset. For a nursing exam, you're usually just looking at the external area for drainage of the ears and seeing if they'll respond to sound and turn. The eyes, I'm going to do the checking for the pupillary reaction to see if it's direct, consensual. They may, between 6 to 9 months, the eyes will start working together, and So right now, the corneal light reflex may show that that their eyes are not working together, they are crossed. And that is a normal when they're in that. If they're old, when an older child, you can get them to follow in the areas. If, again, I'm looking at the arms and the hands, and you open the hands and look at for any the patterns on the palms. See about the grabbing the hands. When you do an abdominal assessment, you can gently flex the legs as you gently palpate the abdomen. Check for their hips to see if there's any, with the movement. Usually can't do both on this doll, but you would check on abducting and adducting. Check the creases to see if they are evenly spaced. And the feet, you can run your finger to do the Babinski. If it's under a year, between a year and 15 months old, they will have the fanning of the Babinski, and that is a normal. As you start walking, it changes to becoming the plantar flexion. You can also get where they will do toe grass. That is a normal area. When I'm going to, I would like to look at the back of the head, the spine. You can check for any dimpling, creases, hair in that area. To look at the mouth, when I look at the lips, the buccal mucosa, the tongue, look at the hard palate, soft palate. When you go in and gag, you get a very quick look, but then they're going to be upset for you to do too much more of the exam. When I'm doing the diaper area, you want gloves on when you're examining the diaper area of the infant. And checking the pulses, checking for any lymph nodes, inguinal nodes. If the baby's uncircumcised, do not retract. You let them urinate and watch that the stream is straight until they're older, and it may be 4 or 5 more where it retracts on its own. Then you teach about cleaning it. But if you retract, it forces and causes scar tissue. If you are checking the testicles, you would pinch to make sure that the testicles don't rise up from the cold. And with the female, you're going to look and examine the openings. You're going to check to see any abnormalities and deformities. I'll put this back on. And this is going in the trash. And I'll wash afterwards. The other, when you're looking at the neurological, besides all the movement and mobility, is to check the tone when you hold the baby. Do they, can they support their shoulders and neck under this? How is their tone? They usually will pull up into a flexed position, besides being really loose and hard to pick up. And we can wrap them, and that's the quick exam. Thank you.